Mental health affects us all, and understanding these conditions helps create a more compassionate world. Today, we'll explore various mental health disorders, what they feel like, how they impact daily life, and importantly, that help is available. Your heart pounds like you're being chased by a lion, but you're just sitting in a coffee shop. Your palms sweat, your breathing quickens, and your mind races with what-if scenarios. Welcome to the world of anxiety disorders. While some anxiety is normal and helpful, anxiety disorders involve excessive, persistent worry that interferes with daily activities. Common types include generalized anxiety disorder, chronic worry about various life aspects. Panic disorder involves sudden, intense fear, attacks with physical symptoms. Social anxiety means intense fear of social situations and judgment. Specific phobias involve extreme fear of particular objects or situations. The reality? Anxiety disorders affect about 301 million people globally. Cognitive behavioral therapy, medication, and relaxation techniques are highly effective treatments. Imagine your brain as a web browser with 47 tabs open, music playing, and pop-up ads constantly appearing. That's ADHD, a beautiful, chaotic, sometimes overwhelming way of experiencing the world. ADHD affects attention, hyperactivity, and impulse control. It's a neurodevelopmental condition that continues into adulthood for many people. Three main types: inattentive, difficulty focusing, organizing tasks, following instructions; hyperactive impulsive, fidgeting, talking excessively, difficulty waiting turns. Combined type features both inattentive and hyperactive impulsive symptoms. The reality? ADHD affects 366 million people worldwide. With proper diagnosis, medication, therapy, and accommodations, people with ADHD can harness their unique strengths. Imagine being at a party where everyone speaks a language you sort of understand, but the social rules feel like a complex code you're still trying to crack. That's often how social situations feel for someone with autism. Autism is a neurodevelopmental condition affecting communication, social interaction, and behavior. It's called a spectrum because it manifests differently in each person. Common characteristics include differences in social communication and interaction, repetitive behaviors or focused interests, sensory sensitivities, and preference for routine and predictability. Strengths often include attention to detail, pattern recognition, logical thinking, and honesty and loyalty. The reality: autism affects about 1% of the population. With understanding, support, and appropriate services, autistic individuals can thrive. Picture an emotional roller coaster that you can't get off. One day, you feel like you could conquer the world. You're energetic, confident, maybe even reckless. This is the manic phase. Then suddenly, you crash into a deep valley of despair where even getting out of bed feels impossible. Bipolar disorder involves extreme mood swings between manic highs and depressive lows. These aren't just good days and bad days, they're intense episodes that can last weeks or months. Manic episodes may include elevated mood and energy, decreased need for sleep, rapid speech and racing thoughts, poor decision-making, and risky behavior. Depressive episodes involve persistent sadness and hopelessness, loss of interest in activities, fatigue, and sleep disturbances, difficulty concentrating. The reality: bipolar disorder affects about 1% of the global population. With mood stabilizers, therapy, and lifestyle management, people with bipolar disorder can lead fulfilling lives. Imagine your emotions as a volume dial that only has two settings: mute and maximum. Relationships feel like the most important thing in the world, but also the most terrifying. This is often the BPD experience. BPD involves intense emotions, unstable relationships, and an unclear sense of self. People with BPD often experience life more intensely than others. Common features include fear of abandonment, unstable relationships, identity disturbance, emotional instability, impulsive behaviors, self-harm behaviors, and chronic feelings of emptiness. The reality, BPD affects about 1.4% of adults. Dialectical behavior therapy and other specialized treatments are highly effective. Imagine looking at a page of text and seeing letters that seem to dance, flip, and rearrange themselves. Reading becomes like solving a puzzle with pieces that keep changing shape. Dyslexia is a learning difference that affects reading, writing, and spelling. It's neurological, not related to intelligence or effort. Common signs include difficulty reading fluently, problems with spelling, trouble with phonemic awareness, slow writing, and difficulty following multi-step instructions. The reality, dyslexia affects 10 to 15% of the population. With appropriate teaching methods, accommodations, and support, people with dyslexia can excel academically and professionally. Imagine a voice in your head constantly criticizing your appearance, telling you you're not thin enough, not disciplined enough. This internal bully controls your relationship with food and your body. Eating disorders involve unhealthy behaviors and thoughts about food, weight, and body image. They're serious mental health conditions, not lifestyle choices. Common types include anorexia nervosa, severe food restriction, and distorted body image. Bulimia nervosa involves cycles of binge eating, followed by compensatory behaviors. Binge eating disorder means recurrent episodes of eating large amounts quickly while feeling out of control. The reality, over 70 million people worldwide are affected. Early intervention with specialized therapy, medical care, and nutritional counseling saves lives. Imagine waking up in a world drained of color. Everything that once brought joy, your favorite food, beloved pet, even sunshine, feels meaningless. It's like emotional numbness has wrapped around your entire existence. Depression is more than feeling sad. It's a persistent state of emptiness, hopelessness, and loss of interest that interferes with daily life. Symptoms include persistent sadness or emptiness, loss of interest in activities, significant weight changes, sleep disturbances, fatigue and loss of energy, feelings of worthlessness or guilt, difficulty concentrating, and thoughts of death or suicide. The reality, depression affects over 280 million people worldwide. Depression is highly treatable through therapy, medication, lifestyle changes, and support systems. Imagine having an itch you can't scratch, but it's in your mind. You know checking the door lock 20 times is excessive, but the anxiety is unbearable if you don't. Welcome to OCD. OCD involves unwanted, intrusive thoughts that lead to repetitive behaviors performed to reduce anxiety. Common patterns include contamination fears leading to excessive cleaning, doubt about safety leading to repeated checking, need for symmetry leading to arranging behaviors, and unwanted violent or sexual thoughts leading to avoidance. The reality, OCD affects about 1 to 2% of the population. Exposure and response prevention therapy, along with medication, are highly effective treatments. Imagine walking into a room and feeling like everyone is watching you, judging you, plotting against you. Every whispered conversation feels like it's about you. This persistent mistrust characterizes paranoid personality disorder. This involves a pervasive pattern of distrust and suspicion, where others' motives are interpreted as malicious without sufficient evidence. Common features include suspicion of others without justification, preoccupation with doubts about loyalty, reluctance to confide in others, reading threatening meanings into benign remarks, and persistent grudges. The reality: this can significantly impact relationships and daily functioning. Therapy focusing on trust and communication can help. Imagine surviving a terrible car accident that claimed your family. 6 months later, you've physically recovered, but the mere sound of screeching tires sends your heart racing. Your brain replays that horrific moment like a broken record. PTSD develops after experiencing or witnessing a traumatic event. It's your brain's way of staying alert to protect you, but the alarm system gets stuck in the on position. Symptoms include vivid flashbacks and nightmares, intense anxiety around trauma reminders, avoidance of triggers, and hypervigilance and sleep problems. The reality: PTSD affects about 3.5% of adults annually. With proper therapy, medication, and support, people with PTSD can heal and reclaim their lives. Remember your childhood imaginary friend. For someone with schizophrenia, those voices and visions never went away, and they feel completely real. It's like living in two realities simultaneously. Schizophrenia affects how a person thinks, feels, and behaves. It involves a disconnect from reality through hallucinations, delusions, and disorganized thinking. Symptoms include hearing voices or seeing things others don't, fixed false beliefs, disorganized speech and behavior, reduced emotional expression, and difficulty with daily functioning. The reality: schizophrenia affects about 1.1% of adults worldwide. Early intervention with antipsychotic medications, therapy, and support services significantly improves outcomes. Imagine lying in bed, exhausted but unable to sleep while your mind races, or falling asleep at your desk despite getting 8 hours of sleep. Sleep disorders disrupt one of our most basic needs. Common sleep disorders include insomnia, difficulty falling or staying asleep. Sleep apnea means breathing repeatedly stops during sleep. Narcolepsy involves sudden, uncontrollable episodes of falling asleep. Restless leg syndrome causes uncomfortable sensations and urge to move legs. The reality: about 45% of people globally experience sleep problems. Sleep medicine, behavioral changes, and medical devices can restore healthy sleep. Mental health conditions are medical conditions, just like diabetes or asthma. They're not character flaws, personal weaknesses, or things people can simply snap out of. Remember, recovery is possible with proper treatment. Seeking help is a sign of strength, not weakness. Everyone deserves compassion and support. Mental health is just as important as physical health. If you're struggling, reach out to a mental health professional. Talk to trusted friends or family. Contact crisis helplines if you're in immediate danger. And remember that you're not alone. Understanding mental health helps us build a more compassionate world. Whether you're supporting a loved one or seeking help yourself, remember that mental health conditions are treatable and recovery is possible. Every person deserves to live a fulfilling life, regardless of their mental health challenges. By increasing awareness and reducing stigma, we create space for healing and hope. If you or someone you know is struggling with mental health, please reach out for professional help. You matter, and support is available.